Hi, welcome back. So in this lecture, we'll cover social support and its effects on stress and health. Social support refers to the perception or experience of being cared for, valued, and part of a network of mutual assistance. Social support encompasses the emotional and practical resources that are provided by other people, like our friends and family, or peers and communities, and it helps individuals cope with stress, enhance their well-being, and foster resilience. Social support improves quality of life, thus it's a powerful contributor to health. It helps reduce stress, cope better, and live positively. It reduces the likelihood that stress will lead to poor health, and it's also linked to longevity. So there are four main types of social support. So one is providing tangible assistance, which is a provision of material support. So providing people gifts, services, financial assistance, or goods. So providing help in some sort of materialistic way. This is a perfect form of social support if someone has a low socioeconomic status and they may perhaps be struggling to take care of their health or being able to afford afford health care. And so providing tangible assistance is the most effective in this type of stressful situation. Informational support is providing education to someone through educating them, giving them the right accurate information about health issues or stuff that they can do in order to reduce their stress level and better their health. And then there's emotional support, so reassuring someone that they are important and cared for. And then invisible support would be helping someone without him or her being aware of it. There's a lot of research that shows positive effects of social support on illness. So social support lowers the likelihood of illness and it speeds up recovery. So studies have shown that people that underwent a major medical procedure, those that had social support were more likely to recover quicker compared to those that did not have this social support when they did go under surgery or some type of medical procedure. Social support also reduces the risk of mortality due to serious illness. It encourages individuals to use health services and stick to their medical regimens. So studies have shown that social support increases adherence to treatment and promotes better health behavior. It can benefit health behaviors, but it can also sometimes lead to bad ones in certain cases. So for example, social influences involving smoking, alcohol, and drug use are more likely to provide negative effects on the person's health. And social influences can also influence healthy behavior though. So for example, friends that work out together or belong to a fitness class are more likely to have a positive influence on your health behavior. So if you don't like to go to the gym, having someone to encourage you to go or that someone to go with you can have a positive effect. But again, those that don't share the same beliefs as you or don't want to go to the gym, being in that environment of influences that don't practice regular healthy eating habits or regular gym habits can have negative effects. So it really goes both ways, and it really depends on your social support network. Social support has also shown to influence biopsychosocial pathways, which has positive effects on health. So social support has effects on the cardiovascular, the endocrine, and immune systems. It lowers physiological and neuroendocrine responses to stress. It can decrease cortisol responses and provide better immune function, and in modifying the brain's responses to stress. And so there was a study done on romantic support and neural activation studies. And so couples that were married and received more social support from their partner, it showed their brain activation in responses to stress were modified. And it also showed that their physiological and neuroendocrine responses to stress were also lowered when they had gotten support from their partners. The direct effects hypothesis states that social support is generally beneficial during non-stressful as well as stressful times, and this is evident when assessed based on the number of friends people have or number of networks people have. The buffering hypothesis assumes that physical and mental health benefits of social support are chiefly evident during periods of high stress. And so direct effects assumes that we feel social support during non-stressful and stressful times, but the physical and mental health benefits typically occur from social support when the person is under high stress levels. So social support does not offer as many benefits when there is low stress or no stress at all, but it is evident when assessed qualitatively according to the buffering hypothesis. So during times of high stress, when people are perceived to be reliable or available to count on, social support provides significant physical health benefits and mental health benefits. The effectiveness of social support really depends on the individual, their social support skills, and the types of support that they're seeking. Social skills and the ability to extract support influence the ability to develop social support. So the more social competence people tend to have, the lower social anxiety and the better self-disclosure skills are linked to more effective social support networks and the ability to form friendships. So it's not always about whether you're seeking social support. Yes, that is a factor, but it's also dependent on your social competence. People that tend to engage in behaviors that may push others away when they are in high stress, this can actually backfire and not be helpful in terms of stress and health. But the more social competence you have and the more effective you can be in social support networks, the more beneficial that social support will be to you when you are during times of high stress. Effective kinds of support include a good quality marriage, family, parental support, and support from the community. People that are more active in the community are more likely to access resources and get social support. Matching support to the stressor is also an important variable. Social support tends to be the most effective when it meets needs that the stressors create, so the matching hypothesis. So, for example, if somebody is looking for material support or financial assistance, emotional support might not be the most effective for them. Social support is ineffective if the type of support provided is not useful. So, as I was saying before, if it doesn't match the needs of the stressor, it will be less effective. So, an example is if somebody is wanting emotional support or encouragement and they get financial assistance instead, this is not going to be the most effective for reducing the impact of a stressor. It also requires skill. So social support requires some level of social skills and competence in order for it to be effective. Emotional support is best provided by somebody close to the individual. So it's not as effective if it's given by a stranger or somebody that you don't know. And social support is effective when the person from whom one is seeking support is perceived to be responsible to one's needs. Social support is not effective and may make the stressful situation worse when the support provided is not the type that's needed. So an example is a person just wants validation but gets advice that they didn't ask for. Studies have looked into negative relationships and their influence on stress and health problems. Studies have shown evidence for bad relationships affecting health. There was a study in 2012 that looked at interactions and competition with others. And they found that negative interactions with others were associated with elevated inflammation of the body and weakened immune systems. So reoccurring conflict with others or being in a toxic bad relationship over the long term may lead to chronic stress and chronic inflammation. People in bad relationships may be at a higher risk of disorders such as hypertension, heart disease, diabetes, depression, and cancer. So other than receiving social support and its beneficial effects, studies have actually shown that giving social support has also beneficial effects on mental and physical health. Enhancing social support prevents a lot of ailments and problems, and it can form a beneficial social support system. And so ways to give social support would be through networking, internet-based systems such as online support groups, family-based systems, and community-based systems. So both receiving and giving social support is associated with a variety of positive health outcomes and reduction of stress impact.